Many people feel nervous about a pap smear or frightened by the idea of abnormal results. And that's completely normal. But the purpose of screening is not to cause fear, it's to give you clarity, options, and peace of mind. A pap smear takes just a few minutes, but it could protect you for years. It's one of the most powerful ways to prevent cervical cancer and to take control of your own health. So whether it's your first time or it's just been a while, this is your reminder. Your health is worth that step. Cervical cancer can feel like a silent threat. And when it comes to screening tests like the pap smear, it's natural to feel unsure, especially if it's your first time and if you have heard mixed messages. I'm Dr. Jayanti Thumsi, a senior breast cancer specialist at Therrapie Healthcare. In this video, I'll explain what the pap smear is, why it matters, and how it helps detect cervical cancer early so you feel more informed, less anxious, and more in control of your health. So let's begin with the basics. What is a pap smear? A pap smear or a pap test is a screening that checks for early changes in the cells of your cervix. The cervix is the lower part of your uterus where it opens into the vagina, and it's here where the cervical cancer begins in most of the cases. Now, during this test, your doctor gently collects a small sample of cells from the cervix. These cells are then examined under a microscope to look for abnormalities. Often years before cancer even develops, these abnormalities appear. It's quick, it's safe, and it's one of the most effective tools we have to prevent cervical cancer even before it starts. So let me explain to you why is pap smear test so important. Now, cervical cancer rarely shows symptoms in its early stages. That's why routine screening is so important. It helps detect changes you wouldn't otherwise notice. And the hopeful part is that cervical cancer tends to grow slowly. That gives us time, often this may be for many years, to identify and treat abnormal cells before they become dangerous. Now, thanks to regular pap testing, cervical cancer deaths have decreased significantly worldwide. This test isn't just about early detection, it's about prevention. Now let's discuss who are the ones who really need pap smear and when should one do this test. If you're between 21 and 29 years, a pap smear is usually recommended every 3 years. From 30 to 65 years of age, you can continue with pap test every 3 years or combine them with a HPV test once in 5 years for broader screening. After the age of 65, you may be able to stop screening. If your recent test results have been normal and your doctor agrees, these are the general guidelines. If you had a hysterectomy, have a weakened immune system, or other medical conditions, your plan may certainly differ. And if it's been a while since your last test, that's okay. You can start again when you're ready. Now, if you have never had a pap smear before, you might wonder what it actually feels like. Now let's walk through it together. So let's discuss what to expect during the pap test. A pap smear is done in a clinic, no special preparation or no hospital stay. You lie back on an examination table where your feet support it. A tool called a speculum is gently inserted into you to help the doctor see the cervix. Then, using a soft brush or a swab, a few cells are collected from the surface, and that's all. The entire process usually takes under 5 minutes. It may feel a bit unusual or mildly uncomfortable, but most people don't find it painful at all. And once it's done, you can return to your regular day. At every step, your doctor should explain what's happening and make sure you're comfortable. Now let's talk about what the results actually mean and what to expect next. Your pap test results typically come back within a few days, maybe 2 or 3 days. In many cases, the result is normal. No abnormal cells are found, and you simply continue with routine screening. Sometimes the result is unclear or inconclusive. That means the sample wasn't easy to interpret, and your doctor may recommend repeating the test after a few months. And occasionally, the result may be abnormal, which can understandably cause concern. But try not to panic. An abnormal result does not necessarily mean you have cancer. It just means some cells appear different than expected, and we may need to take a closer look. Often, these changes are linked to a common virus called HPV or human papilloma virus. What should you know about HPV? Now, HPV or human papilloma virus is the most common sexually transmitted infection in the world. There are many types. Most are harmless and clear up on their own, but a few high-risk types can lead to abnormal cervical cells and over a period of time, that can turn into cancer. That's why, from the age 30 onwards, Pap testing is often combined with an HPV test. It helps us understand your risk more accurately. If your results suggest further follow-up, your doctor might recommend a colposcopy to test a small sample of the tissue. Now, these steps are simply about understanding what's happening and guiding you towards the right care if needed. We understand that all of this can feel overwhelming. Many people feel nervous about a pap smear or frightened by the idea of abnormal results. Then that's completely normal. But the purpose of screening is not to cause fear, it's to give you clarity, options, and peace of mind. And you never have to face it alone. Pap test is one simple step. A pap smear takes just a few minutes, but it could protect you for years. It's one of the most powerful ways to prevent cervical cancer and to take control of your own health. So whether it's your first time or it's just been a while, this is your reminder. Your health is worth that step. And when you're ready, reach out to your gynecologist or trusted healthcare provider. At Therrapie Healthcare, we believe care should always feel human, grounded in trust, compassion, and clear information. If you have questions or need guidance, we are here to walk you through this journey, and we are with you. Thank you very much.